I've been in and out of public life a long time, and I have never had anything affect me in a personal way like the health care debate. I got up this morning in West Miller's Cove in Blount County and drove into the Knoxville airport, and almost every single person with whom I talked on the way into the airplane had something to say to me about the health care debate. And when I get on the plane, here comes another fellow right down the aisle and just hands me a note and says, "Thanks for all your hard work." And Mr. President, none of them are for the health care bill that passed last night. They're all deeply concerned about it. They're worried about it. And they see it as I see it. They see it as an historic mistake. And unlike the Social Security bill, the Medicare bill, the Medicaid bill, the civil rights bills of 57, 64, 68, and later, all those bills passed with significant bipartisan support. But the bill last night was a completely partisan act. The only thing bipartisan about it is the opposition to it. And I think it's important that we continue to say why that's true. The fundamental mistake, Mr. President, is that what the bill basically does is expand a health care delivery system that we all know is too expensive at a time of enormous concern about the national debt. In the middle of a great recession, we are expanding this health care delivery system that we all know is too expensive, instead of focusing our attention, working together to set as a goal reducing the cost of the health care delivery system so more Americans can afford to buy insurance. That is the basic difference of opinion. The Democrats believe we should expand the system we have now. Of course, they make some changes in it. But basically, it's an expansion of a system that's too expensive, and they make it more expensive. We believe that what we should do instead is to reduce the cost of the American health care delivery system, and by doing so, make it possible for more Americans to be able to afford health insurance. Here is what the bill as we now see it does. It imposes even larger taxes on job creators in the middle of a recession. It means Medicare cuts and premium increases for millions of Americans. Now, the Medicare cuts, it is said, are all right because there's some fraud and abuse in Medicare. We agree with that. But what we are saying is that Medicare, according to its trustees, is going broke by 2015, and every penny of savings in Medicare ought to go to Medicare to help make it stronger. This bill spends the money, almost all the money, on a new entitlement. And the bill last night cuts Medicare even more deeply. Some say, well, it only hurts providers, hospitals. Well, those hospitals are the ones who may announce, as some are announcing, we're being reimbursed so little that we're not going to accept Medicare patients anymore. But it also cuts Medicare beneficiaries' benefits. The Congressional Budget Office says that fully half of those who have Medicare Advantage, and that's 1 out of 4 of the Medicare beneficiaries in the country, will see their benefits cut. That's what this bill does. And as far as premium increases go, the President and I had a little friendly discussion about that at the Health Care Summit. I said, for millions of Americans, individual premiums would go up. He said, no, they won't. I said, with respect, Mr. President, the Congressional Budget Office says, yes, they will, by 10 to 13% on the average. He said, oh no, they'll be getting a better policy. But that's like saying if the government requires you to buy a better car and it's more expensive, it may be better, but it's still more expensive. For a variety of reasons, premiums are going to go up. One is the government requirement that you buy better policy. Senator Collins, who was the insurance commissioner in Maine, has surveyed her state. Her conclusion is that 87% of the individual policies there will be more expensive under this bill. Now, it is true that maybe half of those persons would get subsidies paid for by taxpayers, but that still leaves maybe 40% of the individual policies in Maine where individual premiums will go up. They'll go up because we're dumping more people into Medicaid, the state program for low-income Americans, and we don't reimburse physicians and hospitals adequately for those patients, so that today 1/2 of doctors won't see new Medicaid patients. So what do the hospitals and the doctors do when they do see a Medicaid patient? They transfer part of the cost of seeing that patient, that Medicaid patient, onto someone who has private insurance. So that forces premiums to go up. And when you have a provision in the bill, as this does, which says that my policy can't go up much as compared with my son's policy, well, that might keep my policy from going up as much, but my son's going to be paying a lot more. So for millions of younger Americans, I think you're going to be very surprised about the cost of your policy as it goes up. And then the provision to require people to buy insurance was weakened. And because it's weak, a lot of young people especially may not join the policies. And when they don't, that'll leave sicker and older people within the system, and that will help drive premium costs up as well. So for all those reasons, Mr. President, for millions of Americans, it's right to say, accurate to say, that premiums will go up. I was at the University of Tennessee this morning, a tremendous university. Dr. Chu, the president's terrific energy secretary, is visiting there today and tomorrow. I wish I could be with him to talk about the work they're doing between the Oak Ridge National Laboratory and the university and its science program. Senator Bingaman has visited that before. But one of the sort of undercurrent stories in America today is the condition of American public higher education. State funding for public higher education has been flat for the last 10 years. And why is that? Because Medicaid costs continue to rise. Governors can't control those budgets, control those costs. And the reason they can't is because we write the program up here and then send them about 30% to 40% of the bill. And they can't afford it. So what do? They cut the amount of money that goes to the University of Virginia, the University of Tennessee, the University of New Mexico, or Wyoming, and then what happens? Either quality goes down, fewer students are served, fewer faculty are attracted, or tuition goes up, which is why the students who are protesting in California about the 34% increase in tuition at the University of California probably didn't even imagine that the reason for that is because the federal government is causing Medicaid costs to continue to rise, and governors therefore make cuts, and tuition goes up, and this bill will make that worse. And then on top of that, you have the last-minute takeover of the federal student loan program. Suddenly, 19 million students, well, 15 million of those 19 million will go to the federal government to get their loan beginning in July instead of 2,000 lenders across the country. And the government is saying, well, we're going to save money. Well, that may be true, but guess what the government's going to do with its money? They're not going to say, because the government can borrow the money at 2.8%, it's going to cost us less to operate the program. Therefore, we're going to give students the savings. They're going to spend the savings. So they're going to borrow it at 2.8% and loan it to the students at 6.8%. That's overcharging America's students to help pay for the health care program. Now, these students aren't Wall Street financiers. I mean, they're working people, some of them pretty grown up in their 30s and 40s, going back to Walters State Community College. They often have a job, and they're not going to be very happy when they find out that they're paying a higher interest. The estimate that we've made in our office is it might be $1,500, $1,700 over 10 years and more interest. That's the amount the government's going to be overcharging them to help pay for other government programs, including health care. So, Mr. President, the action that's being taken may be historic, but we feel that is an historic mistake, and that throughout the rest of this year, the debate won't end about health care, it will change, and it will be larger than just health care. As the President himself said last year, the health care debate is a proxy for a larger debate about the role of government in America's life. We believe that. We believe that's a debate our country should have, and we believe the country will soundly reject a policy of more taxes, more spending, more debt, and more Washington takeover. I thank the President. I yield the floor.
Mr. President.
Senator from New Mexico.
Mr. President, let me just indicate I heard my colleagues' comments about health care, and I will plan to return to the Senate floor to discuss health care in some detail here in the next couple of days. But I wanted to today